What would you do if you instantaneously witnessed someone having a seizure? Would you attempt to comfort them, or would you panic and call 911 immediately? If you're unsure, you're more than likely not alone. You might not know anyone with epilepsy, but one day you might find yourself around someone who has a seizure. One of my close cousins has epilepsy. Watching someone have a seizure is one of the most frightening experiences. Today I'm going to tell you about what epilepsy is, the different types of seizures that are involved, and the different kinds of treatments. According to epilepsyfoundation.org, epilepsy is a medical condition that produces seizures affecting a variety of mental and physical functions. It is also called a seizure disorder. When a person has 2 or more unprovoked seizures, they are considered to have epilepsy. A seizure occurs when a short, strong surge of electrical activity affects part or all of the brain. According to epilepsyfoundation.org, 1 in 10 adults will have a seizure sometime during their life. Seizures can either be long or they can be short. Some last only a few seconds, while others can last a few minutes. Not all seizures involve a loss of consciousness. Causes of epilepsy in children and adults consist of head trauma, genetic factors, congenital conditions such as Down syndrome, and progressive brain disease, which is rare. Now that I've explained to you what epilepsy is, I'm going to inform you of the different types of seizures that there are. The first type of seizure is called a partial seizure. This is also known as a focal seizure. This type occurs when brain function is only disturbed in half of the brain. There are 2 types of focal seizures. The first type is called a partial focal seizure, which does not involve a loss of consciousness, but it could result in involuntary jerking of body parts, such as the legs or the hands. The second type of focal seizure is called a complex focal seizure. This type does involve a loss of consciousness. It can involve involuntary movements, such as chewing or blinking, for example. The second category of epileptic seizures is called a generalized seizure. There are six different types of generalized seizures, but I'm only going to tell you about 2 of them for the sake of time. The first is called a myoclonic seizure. This type consists of very brief jerks that don't last longer than a second or 2. Even people without epilepsy can experience myoclonic seizures, such as hiccups. In epilepsy, myoclonic seizures cause abnormal movements on both sides of the body at the same time. The last type of seizure I will inform you about is called a tonic seizure. These last usually less than 20 seconds. During a tonic seizure, muscle tone is greatly increased and the body makes sudden stiffening movements. Usually someone will not lose consciousness during a tonic seizure. Now that I've told you what epilepsy is and the different types of seizures that are involved, I am finally going to tell you about the different forms of treatment. According to cdc.gov, epilepsy can be treated by anti-epileptic drugs. There are many different kinds of drugs available on the market, and factors that will determine what one is described include severity of the seizures, age, and related health conditions. Epilepsy can also be treated by surgery. With partial epilepsy, surgery may be performed to stop future seizures or by making them easier to control. Surgery is less common than taking medication, but surgery could be performed when a seizure focus is located within the temporal lobe of the brain. Most people with epilepsy can live a full lifespan with the help of medication. But nevertheless, the risk of death is more likely for some, depending on several factors, such as from severe seizures that lead to serious injuries. These injuries can be life-threatening, and if you ever witness someone having a seizure, you should call 911 immediately. If you don't have time to call 911, make sure you cushion the person's head to prevent head injury. Look for an epileptic identification card because some people do carry those. Never attempt to restrain the person's movements because their muscle contractions can be so forceful that they could injure themselves or even you. Always be calm and reassuring if you ever have to witness this. In conclusion, epilepsy is a very serious disorder. I have told you about what epilepsy is, the different types of seizures involved, and the different kinds of treatment. If you ever have to witness anyone having a seizure, you will agree that it is one of the most startling experiences that you will ever have to witness. I hope none of you have to witness someone having a seizure, but if you ever do, or ever meet someone with epilepsy, I hope you now know more about it.